the next section that we're going to talk about is about anxiety disorders and schizophrenia. Same learning objectives. A lot of the drawings and art that I chose for these PowerPoints were from a website that I found where these pictures were drawn by people who have that disorder, and I just thought that was appropriate. So anxiety disorders, a lot of us have, anxiety just about certain things, but not necessarily a disorder. Because remember how I said a disorder is something that severely impairs your functioning. But the definition or presentation of anxiety disorders in general, and we'll talk about some different types, but it's feelings of fear and apprehension that are out of proportion to the situation. And that's one of the differences between just day-to-day anxiety and having an anxiety disorder. So feelings of fear and apprehension are out of proportion to whatever's going on. So that's interesting. The cognitive presentation is worry, panic, a misfortune, impending doom, that sort of thing. The behavioral presentation is often avoiding the things that cause you anxiety. Makes sense. Things can't always be avoided, though. You have to do things whether or not they cause us anxiety. So, anxiety is another one of those things that often has a biogenic cause. So, one of the causes of anxiety is dysfunction in the locus ceruleus, which is the blue area underneath the cerebellum, which is the center of our anxiety system in our brain. Anxiety disorders cause a reaction with stimulation of thoughts or anxiogenic substances like caffeine or cocaine. Stimulants tend to stimulate anxiety if you have an anxiety disorder. Antidepressants are often used for to treat anxiety, and so why is that? They're antidepressants. But antidepressants have been found to raise the threshold of the anxiety system. So you can tolerate more before it pushes you over the edge. So it raises your threshold. Interesting, right? There are also anti-anxiety medications we'll talk about. So different types of anxiety disorders. A panic disorder is an anxiety disorder. Generalized anxiety disorder, obsessive compulsive disorder, and post-traumatic stress disorder. Those are all anxiety. The pharmacology that's usually used are antidepressants like SSRIs and anti-anxiety drugs like Ativan or Xanax, those type of things. Usually the antidepressants are used regularly to maintain the therapeutic level in the system and raise that anxiety threshold. And anti-anxiety drugs are used as needed. So maybe you need to fly for work and you have to take the anti-anxiety drugs before you get on the plane. That could be one of the things. But so usually anti-anxiety drugs are done on an as needed basis. Panic disorders are severe, frightening episodes of apprehension and feelings of impending doom. The physiological responses that happen during panic disorders are sweating, choking, heart palpitations. The interesting thing is that even though it seems like it goes on forever, most panic attacks only last 3 minutes. And sometimes people, after they've had counseling and everything, they'll say to themselves, okay, I know this is going on, but it's only going to last 3 minutes, and sort of try to talk themselves through it. And that can be a good strategy, depending on the individual person. There is a genetic factor implicated for panic disorders. So there's a biogenic cause for it. It's increased discharge of neurons in the temporal lobes. And there are neurotransmitter or abnormalities, including norepinephrine, serotonin, and GABA. And GABA is one of the inhibitory neurotransmitters in the brain, in the central nervous system. And norepinephrine and serotonin are involved in mood as well. So interesting. Another biogenic. Generalized anxiety disorder is defined as persistent, excessive, or unreasonable anxiety over everyday stresses. So again, it's an over exaggerated response to stresses. Not over exaggerated, that sounds mean, but an amplified, we'll say amplified. Women are twice as likely to be diagnosed with generalized anxiety disorder than men. So anxiety is disproportionate to actual threats. Persistent worry that interferes with daily functioning, difficulty controlling worry and anxiety, and physical symptoms that go along with it. So it can really impact people's lives. It can lead to reduced confidence, decreased productivity, social isolation. There are a lot of people with generalized anxiety disorder who just avoid doing things because they don't want to trigger that. One of my friends called it, she called it a free floating sense of anxiety. She goes, whatever it's going to latch onto, it'll latch onto something. So that's the way she thought about it. The contributing factors, oh, it's genetics and brain chemistry again. It always comes back to that, doesn't it? Not always, but a lot of times. So family history, of course, and brain chemistry, again with the neurotransmitter imbalances. Life stressors and experiences can cause generalized anxiety disorder, sometimes after a stressful or traumatic, especially a prolonged event. Maybe you had a loved one with a prolonged illness before their death. That could contribute to generalized anxiety. The exact cause isn't fully understood. It's likely multifactorial. So, like everything, like so many things. The physical symptoms tend to be headaches, sleep problems like difficulty falling asleep and difficulty staying asleep, digestive issues, muscle tension, fatigue, and restlessness. Catastrophizing can also be associated with generalized anxiety disorder, where you just go straight to the worst case scenario. You don't even entertain any of the other possibilities. So, the most successful treatment for generalized anxiety combines medications and psychotherapy. So, anti anxiety medications for short term relief, those are the as needed ones, and then antidepressant for long term management, cognitive behavioral therapy, coping strategies. In cognitive behavioral therapy, it really focuses on teaching coping strategies and identifying triggers. So, how are you going to cope when this trigger arises? And develops practical anxiety management skills. So, CBT is a really powerful therapy modality that can be helpful for a lot of different things. But developing anxiety management skills, those are life skills right there. For PTAs, we need to think about if patients who have generalized anxiety disorder, they might need extra reassurance and clear explanations during treatment, including clear reasons why they should be doing the things that we're asking them to do. So that extra reassurance, you're doing better, you're getting well, you know, etc. So, post-traumatic stress disorder, PTSD, is an anxiety disorder that develops in response to extreme psychological or physical trauma. So, the trauma may be to um, self, a close other, or generalized. Like the common thing that we think about with PTSD is war experiences, and definitely that's the case. Psychological responses or physiological responses with generalized anxiety disorder um, are in PTSD, and then throw on an extra helping of depression just to make it interesting. That's not good. So, for people with PTSD, there are a lot of different um, events that could trigger PTSD, war experiences, sexual trauma, serious accidents, like people who are in a big car accident or a train accident or something like that, or being physically assaulted, that can trigger PTSD. And lots of different symptoms can result from PTSD. Intrusive memories like nightmares or flashbacks or obsessive thoughts about the events that caused your PTSD. Mood changes, feeling either emotionally numb, like you just like nothing's getting through to you. Relationship difficulties because it changes the way you react to things. Hopelessness, that makes sense. A lot of times avoiding triggering situations or avoiding thoughts about trauma and withdrawing socially because you don't want to go out there when that might happen. You might have a reaction. The physical and emotional reactions can be insomnia, hypervigilance, so someone who's easily startled, and problems with focusing and concentration. I have had a couple people have either panic attacks or PTSD attacks during a therapy session. And so what I do is I make sure the person's comfortable. I'll lie them down, get their feet up, talk to them, cue them in breathing. I don't just say, okay, well, let's end the session and then have them leave. I try to get them calmed down. So when I had one person that I was working with had a major sort of PTSD flare up while we were in the middle of the gym, like a big gym where other people were there. So I got them to sort of a quiet corner, had them lie down and put their feet up, and was cueing them and breathing. I signaled to one of my coworkers and asked her to go get my next patient who was already there and get them started on something, and that was really helpful. And I just sat with the person and was just there for them, supportive, and helped them with breathing until they got through it. So that was challenging. And same thing with the panic attack, comfortable, make sure the temperature is comfortable. The panic attack person felt cold. I got them a hot pack and a blanket and just worked on breathing, told them no pressure, you can stay here as long as you want. Um, got just kind of sat with them and cued breathing, made sure they were comfortable. So PTSD is treated by medications, anti-anxiety medications, antidepressants. The SSRIs should go with antidepressants. Sleep aids sometimes. Therapy, individual therapy, group therapy, social support networks for people that have been through similar experiences. Um, dogs. Dogs can be really helpful with PTSD treatment. Canine Companions has their service dog track has a PTSD track. So if the person's having nightmare, the dog will go over and comfort them. That's really awesome that dogs can do that. There is a high risk of substance abuse for people with PTSD because they may self-medicate with alcohol and other drugs. And also, people are embarrassed about having mental health conditions and they don't want to ask for help. So there's a high risk for substance abuse. So in PT, we want to create a calm, predictable treatment space as much as possible. Avoid positions that make the patient feel trapped or vulnerable. And I have had a lot of patients say, I don't want to be in a closed room. I want to be in a big open area. And we can do that. Explain all your procedures before performing the procedure. Be aware that certain movements, sounds, or touches might trigger flashbacks, and build your rapport with them. Build it slowly and consistently, and let them know that they are safe with you and that you're not going to react or freak out if something happens with them. Schizophrenia is an interesting disorder. It is a disorder of thought or cognition, and it involves severely impaired cognitive processes, personality disintegration, and social withdrawal. They tend to group the symptoms as positive or negative. Positive means you have like extra stuff, and negative means you don't have enough things. That makes sense. So, extra delusions or bizarre behavior, hallucinations. Negative is like flat emotions, decreased speech. General symptoms include disorganized thought processes, impaired communication, often with inadequate language skills, and delusions or false beliefs and ideas. So, delusions are false personal beliefs that are firmly and consistently held despite evidence or logic. So, delusions of grandeur, delusions of control, delusion of thought broadcasting, persecution or paranoia, um, and delusion of reference, where you aren't making those connections. So that is kind of one of the things about schizophrenia is that the connections just aren't there in the brain. So the hallucinations are sensory perceptions that aren't directly attributable to environmental stimuli. So you're hearing sounds that aren't actually sound waves in the environment, or you're seeing things that aren't actually there, or you're smelling things that aren't actually there. Disorganization of speech or thoughts, like tangential speech, or loosening of association. So, like I said, those connections just aren't happening in the brain. And as a result of that, you get disorganized motor activity, either extreme high level activity or extreme low level activity, even to the point of catatonia, or you're not moving at all. So, very interesting, the symptoms of schizophrenia. Um, there are a variety of syndromes that are different with each individual, but there's some commonality. Um, Reduced gray matter in the temporal lobes. And the temporal lobes, a lot of our association cortices are in the temporal lobes. So that's where we take the sensory input and our brain figures out where it goes, and then we decide what we're going to do for output. So that kind of makes sense to me. Enlarged third and lateral ventricles, and that's where the cerebral spinal fluid is made in the brain. So when you have enlarged ventricles, you have decreased brain mass because it's taking up more space, the ventricles. Abnormal cells in the hippocampus, and hippocampus is an area where memories are starting to be formed. And so that's interesting. Excessive dopamine secretion. So there are a lot of different disorders that have to do with dopamine. Um, Schizophrenia is too much dopamine. Parkinson's is not enough dopamine. And ADHD is you need a dopamine spike to focus your attention on something, and you don't get that spike at the right time. There are also decreased blood flow to the frontal lobes, and frontal lobes are where our personality and our executive decision making happens. So, very interesting. There are theories about schizophrenia. None of them are really fully proven, but genetic predisposition and possibly brain damage during fetal development for lots of different reasons. So it's treated with antipsychotic drugs and neuroleptics, and anti-hallucinogenics. Those types of drugs frequently cause side effects related to excessive extrapyramidal activity in the brain. Um, Involuntary muscle spasms in the face, arms, neck, or legs, chewing or grimacing, repetitive jerking or writhing movements, which is called tardive dyskinesia. And some of the side effects of the schizophrenia drugs can be reduced by using anti-Parkinson's agent. And then psychotherapy and psychosocial rehabilitation. Most people with schizophrenia are not able to live a regular life and hold a regular job, because they just can't make connections in their brain, basically. But interestingly enough, people who were diagnosed young with schizophrenia and have been on schizophrenia drugs for a long time, sometimes later in life develop the symptoms of Parkinson's because their dopamine is messed up. So it's kind of interesting. I've worked with a couple people who that was the case because Parkinson's is one of my clinical specialties.